What's happening, everybody? Dr. Z here. ZuluTime episode number 151, and we're gonna be talking about the diabetes secrets. We're gonna be talking about erectile dysfunction today and diabetes, and what does it have anything to do with it. Recently, I was having some conversations with some people, and they were pretty much sharing with me, the struggles that they were having with type 2 diabetes and with erectile dysfunction. And so I decided to do this to be able to kind of talk about this issue. And so the first thing is that, when you have diabetes, definitely, so we've talked about all the complications that can happen, right? We've talked about the macrovascular complications, the microvascular complications, and then we've talked about other complications that happen with diabetes. And so today we're going to be talking about Alzheimer's disease, cancer. That's what we talked about last time, and then the liver issues. And then today we'll be talking about infections, small and nail conditions, and then erectile dysfunctions. And so the first thing is that definitely any healthcare professional will tell you that in terms of infections, type 2 diabetes or obesity can definitely put you at way increased risk of infections, because it's just it increases the inflammatory process of the body, and so there is a lot more damage going on all the time. So the skin, and so there is break of the skin easier to break, and then people cannot feel the pain, so they don't protect their wounds as much, and so it leads to people having severe bacterial and fungal infections. And then in top of that, you do not have the ability to actually go and fight the infection. So for instance, I'll give you an example. Let's say that there is like a riot going on, right, in a part of the city, but if there is a traffic jam, and the traffic jam is so bad that the cops can't even get there, it's gonna be really hard for that city to be able to fight what's happening, right? And so it's the same with diabetes. There is so much damage, and the amount of glucose in the body, the damage that it creates, it increases the how hard it is for the white blood cells, or the cells that fight infection, to actually go to the sites where they are needed. So pretty hard, and so that increases the likelihood of somebody having an infection 4 to 5 times. And especially, for instance, kidney infections, athlete's foot, thrush, which is a fungal infection in the tongue, vaginal yeast infections, fungal infections of the nail, and so they're pretty common in diabetes. Diabetics have a 15% chance higher likelihood of having an amputation in their bodies from diabetes, and most of all, the amputations of 50, half of the amputations around the in the US are in diabetics. So pretty crazy, right? And it's estimated about $25,000. It costs about $25,000 to be able to have somebody help them heal from a pressure ulcer. So definitely has a huge impact in many different ways. And so we know that is because of the high glucose in the body. It impacts the immune system, and there is poor circulation, and then this poor circulation creates an inability for our infection fighting white blood cells to actually go to the specific area and fight them. So that's one of the crazy complications, I would say, of diabetes, the increased risk of infections. A second other type of complication is the skin and the nails. Most of these complications are aesthetic, but people just don't like how they look, but they are a great indication of something that is happening below the skin that is even more harsh, and is more serious. So one of these things is called acanthosis nigricans. Nigricans comes from the word black, and then is a darkening of the skin that is velvety. The skin turns into like almost like this leathery black skin, and this is because of insulin resistance that it creates, right? And what these shows is actually that most of these people have diabetes, and so it's pretty important that if you see this in your body, then that most likely you're starting to have diabetes resistance. And then nail problems are pretty big too. The nail can become yellow when they separate from the bed, and this is called onycholysis. And then the last thing I want to talk to you guys about today is erectile dysfunction. Somebody asked me this question recently, and many times we're trying to look for the one reason. What is the one reason that is causing my erectile dysfunction? In men is a big issue. 10 to 50% of diabetics have erectile dysfunction, and it's affecting more and younger population. What is thought to be of why this is happening is because things like obesity, lack of exercise, insulin resistance, a diet, the metabolic disease, all these things that I mentioned, start to increase the inflammatory process, and then cause damage of the cells in that area, and then end up in erectile dysfunction. And so couple of ways to look at this, right? Many people have this in their later stages of life because they've had surgeries, and they have some functions but not all the functions. So how are you able to actually improve what's happening? Well, you look at it from like a root cause analysis. So if you have this issue and you are trying to make it better, I would start, if you're overweight right now, definitely this will decrease the chance. I put right there a study that shows that about 15% or 15 kilograms of weight loss gave a complete resolution of erectile dysfunction to about 31% of the people. So let me explain it, right? 100 people, you put them and they lose 15 kilograms of weight loss, 30 of them are not gonna have this problem anymore. So if you want to be one of those 30, definitely I would get on that wagon, right? And what is this starts to be is because it decreases the inflammation and it decreases the damage of the cells that make up that area, endothelial cells. And so definitely something to look at. So it's not one issue that is affecting it, but the insulin resistance, the obesity, the high levels of cholesterol, all leading to increased inflammation and damage of the circulation in this area can hurt it. So things like exercise, diet, stop smoking, and losing weight can actually improve this by a lot. And out of 100 people, just by focusing on the weight loss, 30 people will completely not have this problem. So pretty big deal if that's you, or if you've had any other problems and you have some of this function, this could help you regain even a little more of the function. So definitely something to take a look at. So again, this was Dr. Z here. We talked about erectile dysfunction and diabetes and other complications such as infections, skin and nail conditions, and again erectile dysfunctions. And that is it for today, everybody. I hope you guys have an awesome day. If you guys have any comments, questions, or concerns, don't hesitate to put the comments right there on the video. Tell us if you have something that you want us to talk about. I'll definitely would love to talk about something that you want to talk about, and address any issues that you guys have. And we also have our health accelerator program going on right now. So if you want more information about that, comment on the bottom or email us at Zuleta@samastahealth.com if you have any questions about that. And remember, take it easy.